Hi, I'm Danielle, student nurse practitioner, and I'm going to talk to you today about foot and foot disorders. So first we're going to talk about the claw toe and the hammer toe. The hammer toe is commonly with women more than men, and it is usually from wearing shoes that are too small, causing a contracture in the tendons in the toes, in the metatarsals. Mostly affects the PIP, the second joint of the toe, and usually the second toe on the foot. And then the other disorder that we're going to talk about is the claw toe. I'll show you a picture of each of these here. And the claw toe usually affects 4 toes on the foot, and that affects all 3 joints, the MTP, the PIP, and the DIP joints. And having a curling effect. So that's why it's called the claw toe. Again, this is from prolonged restriction of the tendons and muscles in the toes there, causing a contracture. And so wearing correct shoes, doing exercises with those to stretch the tendons. You can massage the toes out. You can pull on the toes gently. And there are other exercises you can do to help release the tendons that have been contractured. One is a marble technique, and I'll demonstrate this here. You use your feet and pick up marbles and place them into another container. And that is a simple little exercise you can do to help release the contractured tendons and improve the muscles in the feet that have the hammer toe and claw toe. Okay, so the next one that I'm going to talk about is flat foot. So the patient behind me today, he has flat feet, doesn't complain of any problems or pain with the flat feet, but things to improve the shape of the Achilles, which seems to kind of have more of a curved motion instead of in line with the heel and the calf with the flat feet. So things that you can do to help improve that are, I want to have you scoot the towel over there a little bit, is a towel curling exercise with taking your toes and stretching the toe onto the towel and pulling the towel in a backwards motion. That helps improve the muscle strength in the pad of the foot and help develop a arch in the foot there. Another technique, you can go ahead and have a seat, is if you use these bands, or you can use a towel, and you'll do this on both feet, all these exercises. You'll put this on the pad of the foot and just kind of pull the foot back gently for about 20 seconds, whatever you can stand. And that's going to help develop muscle strength underneath the arch of the foot there. So you'll repeat this with both feet, and then that helps improve the muscles. So the other foot disorder that we can talk about is feet that have really high arches. So high arches can also cause problems. More patients are going to come in complaining of pain, strains, they've rolled their ankle. This is common because they are disproportionate with their balance. Their balance is going to be mostly the weight is on the fifth metatarsal and on the heel. So just activities of daily living can cause them strains, start to get arthritis, and affects the Achilles. So these patients might come in complaining that they've had frequent falls or frequent strains, and orthopedic shoes or custom foot insoles are solutions for these patients. And then in extreme cases, when we're looking back at the claw toe or the hammer toe, more so the claw toe, these patients may end up having to come in and on examination, like they are not being able to purchase shoes that fit correctly. These may be patients that are surgical candidates if they have like a fixed joint where there's no flexion left in that joint. So these are some foot disorders I wanted to discuss with you today. Thanks for watching.